Understanding the medical system is hard. Understanding oncology is hard. And understanding AYA oncology can sometimes seem impossible. On this episode of Come On In, AYA Cancer Unfiltered, we're going to discuss all the terms, definitions, and confusing phrases you're likely to hear after a cancer diagnosis. Today's topic: diagnosis. Who's who and what's what in AYA cancer? The most common cancers for patients 15 to 39 are breast cancer, brain tumors, cervical cancer, colorectal cancer, germ cell tumors, leukemia, liver cancer, lymphoma, melanoma, and sarcoma. It's important that you know exactly what type of cancer you have so you can make informed decisions about your care. Once you know what kind of cancer you have, you're going to start meeting with a lot of different doctors that have long and confusingly similar names. Dr. Leonard Sender, founder of the Society for Adolescent and Young Adult Oncology, gives more information on the types of doctors you're likely to meet after a cancer diagnosis.
The oncologist. They are doctors who give chemotherapy and often take care of your heart, your lungs, and other parts of your body while you're in treatment. The surgeon is the one who cuts. It's their job to take out the tumor, to try and reduce the bulk of it, or to get it out if possible. A radiation oncologist uses radiation. Science is putting that energy to a good purpose, using it to kill any remaining cancer cells. The radiologist generates imagery. They do the scans or imaging. That enables the rest of the team to know where the cancer is and if the treatment is reducing the size. Depending on the type of cancer you have, different members of your team will take different roles. In a lot of cases, the AYA need all three: the surgeon to take the tumor out, the oncologist treat the cancer itself, and the radiation oncologist takes care of any other cells that might still be in your body. The person who determines the type of cancer you have is a pathologist. Pathology means understanding what your actual cancer looks like. Sometimes it refers to it as a tumor mass or lesion or lump. It's all the same thing. The word cancer means that abnormal cells have come together and started to grow. We take some of them out, put them under the microscope, and we figure out what type of cancer you have. One of the things you're going to hear about is called staging. That means we determine if the cancer is just in one spot, the place where it is first detected, or it is moved beyond that one location. It might have started on your hand, but moved to your armpit. It may have moved to your lung, or maybe even your liver. Those are the aspects of staging called metastasis. There's a special staging system that enables all cancer doctors to talk about cancers they are treating, and all other doctors in other parts of the country or the world will know what they're talking about. Staging is really important because it informs the way your cancer will be treated and also informs your prognosis. It also enables physicians in different locations to help one another come up with the best treatment plans possible.
You may also have medical professionals on your care team who aren't doctors but serve critically important roles.
A registered dietitian, and we are also referred to as a registered dietitian nutritionist. And one who works with cancer patients is called an oncology nutritionist. So RDs have specialized training in using food to promote optimal health and manage and treat diseases and conditions.
That was Jocelyn Harrison, a registered dietitian with a master's in public health and the founder of Pacific Nutrition Partners. And next, we have Jania Riekel, a oncology social worker explaining the role of social workers in AYA cancer care.
We provide counseling, resource navigation, support groups, transportation, a lot of logistics of, home care assistance if needed, the guidance to the process of some of the, applying for Social Security, disability, FMLA, and then any other forms of assistance that I think they need.
In addition to your care team, you may be curious to learn about clinical trials and if you should be a part of one.
There's no reason to be afraid of clinical trials. If a clinical trial is available, I would strongly encourage you to go on it. It is how we make progress in finding better and more efficient ways to treat cancer. Sometimes that trial helps you immediately, giving you an advantage in your treatment, but is always an advantage to everyone in society because it enables us all to better understand the disease and take steps towards curing it in the future.
I was in a clinical trial when I relapsed in my heart at 18.
That's Jania Recall.
And of course, the osteogenosarcoma had pushed through, my treatment, my methotrexate. So they're like, okay, well, if the cancer pushed through and she's got it in her heart, now we got to figure out a different chemotherapy because the other chemotherapy doesn't work. And it was a clinical trial, and we did it, and I survived it. And I think that, and now that clinical trial is one of a major pediatric cancer drugs that we use for osteogenosarcoma. They told us what the side effects would be, that I could get leukemia in 5 years. Luckily, I did not get the leukemia, but I know that another patient did.
If you want to find more information about clinical trials, ask your care provider for options. Clinicaltrials.gov, run by the National Cancer Institute, is a good resource. Currently, it is one of the largest clinical trial databases in the world and includes both national and international studies. Many patients feel unsure about where to find information about clinical trials, or even AYA cancer. Young people often turn to the internet for answers, but sometimes it can be difficult to find exactly what you're looking for, or worse, come across some dangerous misinformation. Some patients even fear they're undermining their doctors by doing work for them. So, you may be asking yourself, should I do my own research?
It's very smart to do research on your own. As an empowered patient, you have to do research on your own. My only caution to you is be careful of the source.
That's hematologist and oncologist Dr. Leonard Sender again.
The best source available to you is the National Cancer Institute at cancer.gov. We pay for this resource with our tax dollars. They provide a free 1-800 number or email form to connect you with a cancer information specialist that will even do research for you. Cancer.gov can give you reputable, evidence-based information on everything from available treatments, clinical trials, and recommendations on complementary medicine.
It can be really difficult to find reputable sources on the internet, especially if friends and family are helping research. Don't worry, you're not alone. There's an amazing support organization with a really good name called Elephants and Tea, who've offered to help clear things up. Please welcome Stephen and Angela Gilarakis to help give advice on finding reputable sources.
Hi, my name is Angie Galarakis. Thank you for having me today to speak to you about our foundation, the Stephen G. Cancer Foundation.
Hi, everybody. I'm Stephen Galarakis. I have had cancer 5 times, 4 different types. So pretty intimately connected with cancer in the young adult space.
And what's your personal connection to AYA cancer?
I started the foundation in 2009 after Stephen had relapsed with a different cancer from his first cancer. His first cancer was stage 4 osteosarcoma. His second cancer was secondary acute myelogenous leukemia, which required him to have a bone marrow transplant. And when I started to research the subject of cancer among young people, I was informed of the adolescent and young adult cancer community. So at that time, I decided I needed to do something to get the word out that this was happening. So that was the starting point of our foundation.
But my first cancer, as my mother said, was stage 4 osteosarcoma when I was 15 years old, diagnosed in 2006, and didn't think about much of helping people or being involved in a cancer community. I really just wanted to be done and be back to being, quote unquote, normal. And it wasn't until after being diagnosed with my second cancer and beating that cancer and then losing a dear friend that really kind of lit the fire to try and find a way to be more involved. Up until this point, I had done some advocacy work with my mother on the federal level, and then even some on the state level, going to talk to the Ohio Cancer Caucus in Columbus, Ohio, the Capitol building. And I enjoyed those conversations, and I realized, that this was the way that you can really make changes within the actual national space of cancer.
Was finding reputable sources something you considered when you formed Elephants and Tea?
Reputable wasn't necessarily the concern. It was more of the idea of how do we be trusted by the community. It's more about, do you have my best interest in mind? And reputable more goes along with evidence, like science. So by making all of our content patient driven, and you're literally, the community is driving the content, or you've already passed the threshold of what's reputable, what's trust.
And can I add to that? So when we first started the magazine, and we had the focus groups and we learned from the patients themselves what they needed, we were also concerned about having information be accurate if we did have any professionals involved. And so we knew that we had to have credible resources, talk to the physicians, talk to the researchers, use, literature-based information. So we even have someone who speaks on sexuality, for example, who is a specialist in that area, and as well as being a survivor herself. The other piece is, as far as credibility, is that on our board we have a physician that that we talk to and refer to if we have questions from a medical standpoint. We have a social worker, a certified social worker on staff now. She can be handling some issues as well, so that we can bounce the ideas off and talk to each other about what's happening, what is the issue. And also our resources that we have at the back of our book, our magazine, excuse me, those are vetted. We don't just throw them in there without looking at it and making sure that it's something or someone that's providing resources. I tend to be skeptical as a professional and as an advocate when people are selling information. To me, if you're an advocate, you're not selling information.
Is there any additional advice you'd like to give AYAs about finding online sources?
I know from the medical side, if I could tell someone right now, I really would say there's only a couple places that I would go to for any type of information. The Mayo Clinic is one, NIH, which is the National Institute of Health, and CDC.gov. Definitely never go to WebMD.
And last question. I have to ask, how did you get such a unique name for your foundation?
It was an online poll. We passed over the name Elephants and Tea 3 or 4 times, he said. And then
Yeah,
the person and then the person put the tagline. And the tagline, cancer is the elephant in the room and tea is the relief that conversation provides. And once he put that tagline with it, we were like, that's it. That's it right there.
Yeah.
Moving on, we want to talk about organizing your health information. You're going to want to start keeping track of all your doctors' and medical teams' contact information, your medications, treatments, and scans. I promise you, this will save you a lot of headaches in the future. Consider making a folder to help keep it organized. Try to keep one digital copy and one physical one, so nothing gets lost. You can use this document to help you keep track of information during doctor's appointments, chart your medical progression, explain what's next in your treatment roadmap, and eventually to continue your care after cancer treatment ends. So yes, as you've heard, it's very important to organize your health information. But what about your personal information? To do that, you're going to want to keep a journal. Cactus Cancer, an organization who works with adolescent young adults who have cancer, who have had cancer in the past, and their caregivers can help. Lauren Creel and Mallory Casperson have kindly agreed to join us today to talk about journaling through your cancer.
My name's Mallory Casperson, and I am the CEO at Cactus Cancer Society, which is a patient advocacy organization that runs online programs specifically for young adults facing cancer. My connection to the young adult cancer space is both through the organization Cactus Cancer Society, but also through personal experience. I was about to graduate from undergrad when my mother was diagnosed with cancer. And so I first served as a young adult cancer caregiver. And then 2 months after she passed away, I was diagnosed myself with Hodgkin's lymphoma. And then 10 years later, I recurred. So I'm a two-time cancer survivor myself.
Yeah, I'm Lauren Creel. I'm the COO at Cactus Cancer Society, and I'm also a Hodgkin lymphoma survivor. I was diagnosed at age 23 when I had just entered the workforce on my own, and was paying my own rent and buying my own groceries and stuff, and got diagnosed and had to move back in with my parents and go through treatment.
So, what does Cactus Cancer do? What's your focus?
Yeah. Cactus Cancer Society came out of an extreme lack that I had in any sort of psychosocial survivorship care. The NCI designated institution where I was treated the first time didn't really recognize young adult as a disparate audience unless you were a breast cancer survivor, which I'm not. And so there was no easy way for me to connect with other people my age who had been through cancer. And so we started as a blog and very organically grew over the last 8 years into the nonprofit that we are today. We really focus on creative coping and peer-to-peer connection, getting these young adults connected to one another.
Yeah, so I met Mallory at a young adult cancer conference in, I want to say 2015. I think it was right after she had just started the blog and just got nonprofit status. I had met her, and we became really quick friends, and then came on board as staff in August of 2021.
Why is journaling so important for those with cancer? How has keeping a journal helped you in your journey?
For me, my personal story, I've always found journaling to be really helpful when I have a lot of complex emotions going on and complex thoughts happening, to really sit down and take the time to write it out. My mind is always racing with a million thoughts. And so for me, journaling helps me to kind of slow that down and get everything organized in my brain, which has really helped me, just to process through what I'm going through. And it helped me a lot during treatment to process, I'm going through a potentially life-threatening experience. Just, at the time I was in my early 20s, I didn't really know how to manage all those emotions. So journaling really helped me to kind of process through all of that.
I think journaling too offers just this very structured way of processing through writing or doodling, however one chooses to journal, as opposed to sort of being just facing a blank page and not knowing what to do. It provides this very easy structure, this very nice time limit that removes, I think, a lot of the pressure and allows that processing to come more readily.
How do you incorporate journaling into your programs at Cactus Cancer?
Our journaling programs at Cactus Cancer Society utilize a certified journal therapist. So in most of them, she will give a prompt, and then people will have a chance to respond to that. And then we open it up to sharing. People can share if they want to. And then she gives her therapist response.
And we have another writing program too that's structured a little differently and focuses more on a creative writing aspect. And so all the pieces are assumed fictional, which I think is an odd thing for people at first, but it really lets you process however you'd like. People aren't allowed to ask questions afterwards. So there's no worry that someone will dig into something uncomfortable that you're not ready to talk about yet. What you share is what people get, and you can write it however you want, which I think is helpful too.
Mallory, I know you have a unique form of journaling. You write personal stories, yes, but you also write poetry. Can you talk a little bit about why poetry has worked out so well for you?
I think for me, it offers a little bit of like a veiled way of expressing something that has happened. Like it gets to sort of live in this more artistic feeling medium that is very direct and concise. Journaling and writing in general is, at least in the ways that we offer it, you're often allowed / encouraged to really pick whatever medium you'd like to respond in general. And so I think that just watching people's evolution through their survivorship, and in this case, my evolution, is just an added bonus to everything.
And Mallory actually brought us a poem to read. It's titled In the Wide Open Air.
In the wide open air. Sometimes, in the dark, I whisper the things I am most afraid of. The make it or break it things. The do you ever feel that way? And the do you know what I means? The phrases whose answers I am most afraid to hear, but also the phrases I need to get out of my head where they won't fester. Out where their power wanes as air sifts in between their cracks and into their crannies. They don't look so big anymore in the wide open air.
Thank you, Mallory. That was beautiful. And that was the end of the episode. Thank you for joining us. The phone number for the National Cancer Institute, cancer.gov, who provides free research assistance, is in the description box below. Please check that out. They're a great resource. Next time, we will dive into oncofertility. Tune in to Diagnosis, your fertility options before treatment, for more information. Remember, any fertility preservation you might do needs to occur before you begin your treatment. Take a deep breath and move one step at a time. We're here to help you find the resources you need. It's going to be okay. See you next time. This has been Come On In, AYA Cancer Unfiltered, a podcast for patients 15 to 39. This podcast was produced by Reimagine Well with funding by 70K. Our creative producer is Emma Grace Eisenman with video production by Sedona Cruz. Our creative director is Roger Holzberg. Our content supervisor is Adele Sender. Our project manager and coordinator is Pamela Primessa Karstens. Our social media manager is Sedona Cruz. Our social media intern is Ryan Meglino. Script by Emma Grace Eisenman, based on the Adolescents and Young Adult Cancer and Oncofertility Guides by Reimagine Well. Audio editing by Emma Grace Eisenman. Video editing by Sedona Cruz. Additional audio and video editing by Graham Karstens. Digital artwork by Ray Jameson. Graphic design by Sarah Gray. A big thank you to our medical experts, Dr. Leonard Sender, Dr. Lakshmi Kondapalli, Jocelyn Harrison, RDN, Ginny Urikel, MSW, and Debbie Wagers, CCLS. Our guests for this episode were Johnny Immerman of Closed Talk and founder of Immerman Angels, Mallory Casperson, MS, co-founder and CEO of Cactus Cancer Society, Lauren Creel, MSW, MPH Chief Operations Officer of Cactus Cancer Society, David Craig, CEO of Grit Health, and Lauren Lustauskas, Vice President of Community at Grit Health. Stephen Giolarakis, President of the Stephen G. Cancer Foundation, Angela Giolarakis, PhD, founder of the Stephen G. Cancer Foundation, and Blake Dirksen. Thank you. This podcast is possible because of you. I've been your host, Marie Sad, and thank you for listening.